Welcome to Plugged In, a podcast about our co-op, our community, and our shared connections presented by Okefenokee RAMC. I'm your Director of Communications and Marketing, Michelle Hutchins, and on this episode, we are going to be talking about teen mental health. Did you know that according to the CDC, about 40% of teenagers experience sadness or hopelessness? And according to the World Health Organization, about 30% of teens, 10 to 19, have some sort of mental health issue, whether that's depression, anxiety, or a behavioral issue. And then add into that, about 30% of teens are actually diagnosed with anxiety, according to the National Alliance for Health. I was prompted to look into these statistics based on my conversations earlier this year with students participating in some of our youth programs. And they were asked a question that if you had the opportunity to raise an issue affecting rural youth with elected officials, what would you want to talk to them about? And almost all of them talked about mental health, anxiety, and or cyberbullying. And I just thought, okay, this is a real issue worth talking about. May is Mental Health Awareness Month. And so that is what we're going to be talking about on this episode of Plugged In. And joining me today is Katrina Chisholm, who is the Director of Mental Health at Morningstar Children and Family Services, and intern Angel Williams. Welcome to both of you.
Thank you.
Okefenokee RAMC became associated with Morningstar earlier this year when our ORMC Foundation awarded your residential program a grant. Katrina, tell us a little bit about Morningstar Children and Family Services and your role there, and Angel, what you're doing there as well.
So Morningstar is a group home, but the program that I work in is outpatient services. So that's an entity of Morningstar. And we provide outpatient services to surrounding communities. We service about 5 or 6 counties here. And so my role as the mental health director is to oversee that outpatient program.
And Angel, tell us a little bit about what you're doing and learning as an intern.
Yeah, so I'm just soaking up everything, information that I can soak up, working under Miss Chisholm and just learning, honestly. Yeah.
The students' answer I found surprising, but it's probably not surprising to you. So I guess, is teen mental health more of an issue than it used to be? Or are we just more aware of it? Can you shed some light on the subject?
I don't want to say it's more of an issue. I think the awareness is there now.
The awareness.
Whereas during my time, we didn't have access to a lot of things like we do now with social media and all of those different platforms. So I think the awareness is there, which shows an increase in the data that supports an increase. But I think the issues have always been there. I think now we are more aware of teen mental health issues.
Were we not calling it mental health issues?
We were not.
Back during my time in school or your time in school?
No, we were not. We kind of looked at it as, you'll get over it. You're just going through a phase. It's not that serious. Culturally, a lot of people would turn to spiritual or religious beliefs to kind of help them cope and deal with things and just not addressing it. So today is more aware. Teens are more open about what's happening, due to their personal experiences. Their friends are going through mental health issues. So the awareness is there now.
Well, what changed?
I think social media kind of put it out there, right?
Put it out there as a determinant of mental health issues or awareness or both?
I think a little both. Everything is on the internet. You have all these different platforms like Facebook, TikTok, Instagram. And so kids are utilizing those things more than we had access to. And so now they are in the trenches, I like to say, they have a lot of cyberbullying going on, a lot of peer pressure. they're being exposed to more trauma on these sites. So
What do you mean by trauma?
a lot of the trauma, like, bullying. Bullying is very serious with teens, or these relationships. I have a lot of teens who come in services who are in relationships and, they're abusive, substance use. So it's a lot of things that's happening in their, little space that's contributing to a lot of these issues.
I mean, is it just social media? It can't just be social media.
No, also our environment. They have stresses within their families. Things are going on within their households. And a lot of times, the guardians of the adults have their own mental health issues that are not being addressed. And so sometimes the teens are presented as the scapegoats, meaning, they're the problem. They have these issues, but the adults in the home aren't recognizing that they are also contributing to some of the kids' mental health issues.
So when we talked about mental health issues, and you mentioned cyberbullying, but I mean, what exactly are we talking about? What are the kids dealing with? What are they struggling with? What is it they're seeking help with and awareness of? Anxiety,
depression. A lot of them come in with depression, which looks like, the sadness, the isolation, but it also manifests in anger and aggression. And so the biggest issue, not the biggest issue, but one of the issues is substance use. Teens are abusing substances, but they minimize that. I smoke a little marijuana, it's not a big deal. Not recognizing and understanding that is a gateway,
Well, and they're using it as a coping mechanism.
Right.
So teens say or the ones that I had talked to are saying, we need to talk about it more. We need more assistance. We need to raise awareness. I mean, you're saying that a lot of the depression and anxiety is leading to substance abuse. But I mean, when we say a teen has depression and anxiety, I mean, what are they exhibiting? You said the sadness, but what are the symptoms they're exhibiting? What are the behaviors that are out there? What are the struggles that they're presenting with?
Teens will isolate, and so when you start to see your teen isolating, not engaged in activities as they used to before, or just, not just wanting to do things, those are some symptoms that, we may have a problem here. Mm-hmm. Failing grades, in school, if you notice your teen was an honor roll student and then all of a sudden their grades are starting to decline, that's something you need to pay attention to. What else? Just any thoughts or communication or talks about self-harming or suicide. You need to pay attention to that. Also, if they're changing for friends, if you notice that they were hanging out with, kids who were, involved in doing good things and now they're hanging out with the bad kids, those are some things that, should raise your awareness to something may be going on with my teen.
Now, obviously, as you said, you're outpatient counseling. Mm-hmm. And so you are talking to some of the teens who are struggling. But as a general rule, are they talking? Are they afraid to talk? Are they not feeling like they're being taken seriously? What's the trends there?
A lot of them aren't talking or afraid to talk due to, feeling like, they're going to be deemed as weak or, they're going to be an embarrassment to the family. But some of them are coming in, and expressing things that they have going on. And I go back to the family environment because a lot of times, things are happening within their households. And, it's shameful to talk about what's going on in our house. And so they kind of, don't want to say some stuff. But when they get in an environment where they feel safe, they will disclose and talk about things that's happening.
Angel, I know that I threw out a few statistics there, and I'm going to throw out one more to let you comment on. I think as I was looking at numbers, one of the things I think I saw from the National Alliance from Health was that by age 14, if a person is going to have ongoing mental health issues, that it's entrenched by age 14. But my numbers are kind of overarching U.S.-wide. What facts and figures can you share with us, Angel?
I would also like to input, just talking about the social media aspect of things. The social media platform, it can be like have trauma, or like kids can experience trauma through that. But I think also through social media platform, it's also helped raise awareness, and like kids are able to see that it's okay not to be okay. Mm-hmm. And if you're not okay, you should seek help. And I feel like some influencers are utilizing their platform to promote that awareness as well. So I think that's another reason why mental health is starting to become aware through technology.
So it's kind of a double-edged sword. On one hand, we see it as a contributing factor to teens having access to image and ideas or ideals that we all know are, AI, as we say, creates a false reality. And, not everybody's going to have the right brand or have the right look or what they aspire to is more readily available. I mean, those were issues when I was in school. Right. I'm sure when you were in school, but we didn't have it all in our fingertips to see the broader sense. So I certainly appreciate that. But I also appreciate what you're saying, Angel, is it has raised awareness. And some of the more recent, I'll point to athletes. I mean, as Simone Biles is the one that always comes to mind to me with the Olympics, 4 years ago, where she just couldn't compete because she said, I needed a mental health break. And I think we've heard that from some tennis players who have also struggled with it, and just acknowledging, that those are the people that kids look up to, and seeing them say, hey, I'm not okay. To your point, it's okay to not be okay. Do you think that's helping?
Yeah, I do believe that's helping. They see their idols on TV, and they're open and honest about their mental health journey, and it just causes a domino effect. And so I think social media is a plus in that sense.
So, I mean, I know it's a national dialogue, and I think even a headline this morning is that the LA school system is banning use of students on computers in schools until after grade 1, because they want reduced screen time. They want to promote reduced screen time. So why is it, do you think, that this device and social media has exacerbated many of the same issues we all experienced? I mean, there were, 17 magazine. I'm trying to think. I'm really dating myself, of course, but teen magazines that had, the latest clothes and the best hair and the best look. And I mean, I certainly never came across as any of that. And, some of us handle it better than others, I guess. But how is social media different than that, do you think? Because there's that two-way communication. You put yourself out there, you get feedback, and it may not always be positive.
And I think that's it. Because like in our times, we experienced bullying. We, had to go through those things, but it was just small little group of people, right? When you are on social media, this is the world. Yeah. And you have all these different people who are able to comment. And sometimes teens just don't know how to log off, right? Just don't pay attention to it. Don't look at it. But it's just something about it. It just keeps you going, keep you going back to it. And so I think the accessibility of it is what's the issue. It's kind of like a blessing and a curse.
Right. So, I mean, again, I threw out some numbers, but what truly is the incidence of teen mental health? How would you quantify it?
I did see where suicide was the third cause of death amongst students between 10, I want to say, and 19.
Mm-hmm.
That when I saw that really did something to me, because just to know that children that young are actually thinking about things like that. I, I couldn't imagine
Well, that's a
being that
pretty
young.
extreme
Yeah,
response.
I couldn't imagine being that young and things and stressors and trauma, like going through that and it causing me to, get to that point. So that really that did something that shocked me.
Hate to use the word, but the shocked or surprised or whatever is what I felt, to just for the kids to be saying this was the issue. And yeah, the statistics are not great, but how do we address this? Not how do we address this individually? How do we address this collectively, societally? How do we attempt to fix this?
First, I think we have to normalize it, like educating our youth on that it's okay. Like Angel said, it's okay to be different. It's okay to have mental health issues. Treat it like it's a physical health problem, right? We go to the doctor when we have physical health things. We can go to a mental health professional to seek counseling. I think families need to start getting back to family-oriented things, like building a relationship with your children, talking to them. Access to services, especially in rural counties, is a challenge. It is a barrier. I think we need to get more services in these rural counties. Like we service Brantley County, we service Camden County, but the distance. Families, if you don't have transportation, you can't get there.
Yeah.
With resources with the insurance companies, a lot of insurance companies make it difficult, for families to access services. So, some of the people that's on these boards and these insurance companies, educating them on, the communities that we serve and making the services available, making it not difficult to get an authorization for services, putting the resources in school. We have school counseling, but honestly, if you think about it, you can't really go do counseling in school. They have some services you can provide in school. A few years back, we were able to go in and do counseling in schools. We can't do that now. They have things where, more policies in place that kind of prevents you from being able to go provide that services. But when your parents don't have transportation, your therapist can go to the school and see you. And so they've kind of removed that. Just overall education. We need to educate our families and our teens and, showing them where they can go and get, resources or access to services. So education, awareness, and normalizing it.
Well, I know one thing that you hear about sometimes is, and I see it with my own family and friends, but family dinner. Dinner at the table every night. It seems like something simple, but everybody's running 100 million different directions. That's taking the time to sit down for dinner. Who has time for that? But at the same time, it was a norm that is not so much one anymore. And I wonder, if that provided that coming together, that, kind of talking about your day, talking about, even if kids weren't completely honest with what was going on in life, at least they were together with family, their nuclear units at home. But, if you listen to people, that's not And maybe it happens on Sunday, but it doesn't happen Monday through Saturday. Though, and I think that's some of what you're saying is more time with family. It's not just less screen time; it's
Right.
more engagement. And I'll share another observation. Is we all are on our phones all the time, and now we wear earbuds, and we're walking our dogs, not talking to our dogs. We're strolling our kids, not talking to our kids. We're pushing a stroller and talking to whoever's on the phone. I see it constantly in my own neighborhood. And some will say, well, why talk to your dog? But I don't know. I used to talk to my dog. But I think it's that disengagement from what's right in front of you. Is that a contributing factor?
It is. We have to. How are you going to recognize the changes in the behavior of your child if you're not spending time with them?
And you don't mean spending time in the living room, everybody on the phone.
No, you need to spend some intimate time with them, talking with them, asking open-ended questions. When you recognize things going on, bringing it to their attention, and just paying attention. But always creating that space for them to feel comfortable coming to talk to you. And so I think that's missing a lot today because we are on our phones.
You mentioned earlier some signs that maybe your child is struggling, changes in behavior, isolation, change in friends, change in grades. But the flip side of that is do kids feel safe enough to talk about what they're experiencing? So I guess maybe elaborate just a little bit more on what do you look for to then approach a child about, are you okay? Are you struggling with, how do you make them feel safe? It's kind of an interesting, because it may not always be the parent they feel safe with, I guess.
Well, and that's a good point. And just for me to be a little transparent, when my daughter was a teen, she's 26 now, but when she was a teen, she didn't feel comfortable talking with me about certain things. And initially, I didn't understand. I thought I was a good parent, right? I thought I was doing what I needed to do. However, it was my tone and my approach, right? And so her personality, it didn't mesh with that. But she did feel comfortable speaking with my sister-in-law, right? And so when she would go through things and she didn't feel like she could talk to me, I always encouraged that relationship. I said, if you feel comfortable talking to your auntie, that's fine. Go ahead. I just want you to be able to talk about whatever it is that you have going on. And so having that relationship with other family members, right? So that they can share with you what may be going on with your child. But just really any sudden changes, and some things aren't always sudden, they're gradual, right? They may start hanging out with their friends and then you notice they're gradually stepping back. So just paying attention to things like that. Just, where they're going, who they're hanging out with. All those things are little telltale signs that something's changing with even if they start changing in dress, right? You're paying attention to how they're dressing. Those are times you sit down, and have the conversation. Bring to the attention, I'm noticing, that you've started showing more skin lately. Why is that? What's going on? It's just, but not in a judgment type way.
Right.
Just letting them know, I see you, you cute and all, but, making them aware this could be some unwanted attention that you are, bringing on. So just always making them feel comfortable to be able to come talk to you about what's going on with them. And parents, guardians, paying attention, taking that time to sit down and talk with your teens.
And I guess it's, everybody's different in what they respond to. And obviously a lot of what we're talking about right now, if for lack of a better description, is some kind of talk therapy. But just out of curiosity, there's talking about what's bothering them or upsetting them or causing them anxiety. But what are other strategies that if someone is feeling these things that they can help them? They need to talk about it, but there's got to be other things that they can do to channel that energy, that frustration, that, to just kind of manage how they're feeling? What sort of things do you typically recommend?
Well, I mean, like you said, talk therapy is great, but if we're just all talk and not about doing anything, then what? How do we fix what's going on?
Right.
So they need to learn some coping skills. A lot of times we've learned, from our environments, from our parents, on how to cope with things. And if I'm being honest, our parents weren't the best teachers in coping. Either they ignored or they just didn't address it or whatever. And so we pass those things down to our children. So they need to learn some coping skills, emotional regulation skills, being able to recognize, that throwing up I do every morning before I go to school. It's just not, I'm just throwing up. There's something connected to that. And that could be an underlying issue, right? To anxiety, what's going on. So teaching them coping skills, emotional regulation skills.
So what kind of coping skills? Are we talking a 5-second rule of just honoring that you're having an issue? Is it stepping back and, taking a couple deep breaths? Is it going out and go for a walk? Or, what are some of those?
Those are some things, but each person is different, right? You're going to individualize that care to that person's, more so looking at their strengths. So it may be just counting and deep breathing, or it may be something deeper as journaling, sitting down, writing in your journal and being able to go and process that with someone, a trusted person. It could be just exercising, right? Maybe you need to start exercising more, or it could be some more work that needs to be done,
Sure.
Like some cognitive behavior therapy or some other therapeutic interventions that may be needed. But each person is different, their needs are different. It could be some family counseling, right? We keep pushing the issue as the child, that the teen is the problem, but this is a family problem. And so we may need to, some therapeutic interventions for the family. So it's just really based on the need of the person, what they have going on, and then you kind of tailor that treatment plan or whatever to their specific needs.
Well, and I think that's an important point. Like you said, we look at the teen, but what I hear you saying is the teen is typically the teen or a teenager's reaction or anxiety or depression typically is a reaction to a bigger issue that they're a part of. They're almost a symptom of a bigger problem.
Exactly.
Is what I hear you saying.
Mm-hmm.
So, it's kind of the entry point in terms of addressing maybe that bigger issue.
And that's the challenging part in my experience.
Yep.
It's that bigger issue because nobody wants to look at and I'm speaking more of the guardians and the parents, they don't want to look at their issue. They just want you to fix my child, fix the problem. And they don't realize there are things going on within their environment that are contributing to the problem. And so sometimes it kind of pushes the teen away from wanting to do anything or to continue to say anything about it. And then the problem never gets resolved because the issue is the bigger problem, the family. We need to address the family. And to me, in my experience, that's the biggest barrier in teen treatment is the parents just aren't as engaged as they need to be in the services. And so you never really address the problem.
Well, and as you said earlier in our conversation, many times the parents themselves are struggling with something that just kind of impacts or gets passed on, and it's not meant to be intentional. It's just situational, which I guess, we could take this conversation to a whole other level. We've talked about a lot of different things. Is there anything in particular we haven't talked about that we should touch on or be aware of in terms of, what teens are experiencing and how we can help?
Like it was mentioned earlier, education, like just educating yourselves on mental health and also resources. Like I know that right now that is a barrier, like with resources. So I was making seeing how you can utilize yourself within the community with being an outlet for children who may not have access to those sort of resources. Education. That's all. That's what I can say. Educate yourself.
To that point, we've talked about the whole impetus of this was the fact that rural youth, we are a rural community essentially. Things are a little more limited than they would be. But where's a good place to start? What are some things that you could immediately reach out to if you're seeking help with a teen in your life? Is it the school? Is it your organization? I mean, are there other places to reach out to? Where's a good place to go look?
Believe it or not, it is the schools. They have the information in the schools that can connect you to your pediatrician. I know your dentist. When I go to the dentist, they now have questions embedded into their intake forms that kind of, lead you in that direction. Morningstar, we're here in the community, and like I said, we service, 5 other counties here. But just, knowing who your community providers are and, connecting yourself to those persons. Good Google. If you Google this new AI stuff, it will kind of guide you. But just,
again, the pros and cons.
That's right. But it's going to lay it out there for you, what resources are out there. But the schools have them. They also have apps now, where you can connect and get guided. It's a lot of information out there. It's really just getting it out to the people that it needs
knowing
to be
where to start.
Mm-hmm.
Well, and I think just to wrap up a little bit, and I think we're moving toward this more so than say we were, but every year students have a physical. They have to have a physical for schools and sports, and even adults. We have to have, certain things that we're supposed to do for promoting and preventing, health issues. Mental health needs to be kind of more ingrained in that holistic approach to health. I mean, and we didn't talk about this. We sort of alluded to it. Sometimes the symptoms of a mental health struggle, depression, anxiety, behavior, presents physically.
That's right.
So it's all tied together. And I think providers, like you said, dentists and pediatricians, and I think we're starting to head that direction, trying to identify things. But as parents and caregivers and guardians, it's paying attention, taking notice, and when you start to see some of those subtle little changes, have the conversations or seek help through the school system is a good place to start.
Yep, start with the school. They have school counselors who don't really do the counseling, but they can refer out. And so like Morningstar, we have some relationships with some of the schools here. DFACS, Department of Family Children Services, we get a lot of referrals from them. So there are organizations out here where if you need it, just reach out and they can direct you where you need to go.
Well, thank you both for being here this morning to talk about this issue that not only are adults recognizing as an issue, but the teens themselves are raising as a concern. And hopefully this will shed a little light on the types of issues we're seeing and where folks can try to get help for their teenagers in their life that may be having a struggle.
And thank you for having us.
All right. Well, thank you. So thank you for listening. And until next time, take care, everybody.